Speak now to Dr. Leyla Hannbeck. She's the Chief Executive of the Association of Independent Multiple Pharmacies. Morning to you, Leyla. So you heard what the Secretary of State had to say, and he, of course, has responsibility for supplies in England. What is your experience of the supplies of penicillin?
Well, we are getting calls and information from pharmacies everywhere in the country, basically saying that it's very difficult to get hold of antibiotics. So when they go online to order from their wholesalers, they get a red message coming through saying it's out of stock or stock unavailable. So it's at odds with what Mr. Barclay is saying, and if there is supply, then we would urge the department and the minister to please make sure that they flow through pharmacies so we can look after our patients.
You presumably have been talking to the Department of Health about this?
Well, we've raised the issue that there are challenges with patchy supply across the country, not just one area, and they are aware of the fact that pharmacies are struggling to get hold of these. So we are hoping that they actually quickly act and ensure that the supply flows, because we have seen a big rise in the number of antibiotic prescriptions this winter. So if we don't act quickly, it's going to be very difficult going forward.
Can I be clear? Is the issue particularly with liquid penicillin, which is what's often given to children?
Well, the current issues are mainly with penicillin, mainly liquid, and amoxicillin, again liquid, and some other antibiotics that are quite commonly prescribed. And these are mainly, yes, for children. So, once a first line is kind of running short, then the second line and the third line and all of them subsequently go on shortage as well, because the GPs then have to change the prescription to have the stuff that is available. So it affects on the rest as well. So it's an important thing for the department to make sure that they prioritize this to ensure that the stock that they say they have flows to pharmacies as soon as possible.
So listening to the Health Secretary, Steve Barclay, there, he seemed to be saying that the stocks are there. So one wonders, is the problem actually one of delivery, one of getting the stocks to the relevant places?
Well, we have on a number of occasions asked the Department of Health in terms of sitting down with us, manufacturers and wholesalers, and discuss, the challenges in terms of where the issues lie and find solutions and plan better. So this would allow us to identify exactly where the issues are. At the moment, we are kind of working blind. What we need to do as pharmacists is we go online to our wholesaler, the normal route, and we order the medicine, and we basically get a message coming through that stock is unavailable. And that's where we are at the moment.
And if that happens, when that happens, I mean, are pharmacies having to turn away patients?
Well, yes. So we've had many times patients coming in and asking for the antibiotic with a prescription, and the pharmacy has no stock in, so they have to send them to another pharmacy. So this morning I was getting reports that, for example, a patient had been traveling 20 miles to get hold of antibiotic. There was another report about a patient who had to visit 12 pharmacies before they actually got hold of the stock. I don't want people to panic that there's not going to be nothing available and stress, because I'm a parent myself and I know how stressful this is. So it's, they need to be reassured that we're doing everything we can to ensure that we get the stock in. But we do need the support from the department to get this supply that they say they have into pharmacies as soon as possible.
This is the second time this year that pharmacists have reported a patchy supply, because we had the whole issue with HRT over the summer.
Yes.
And was it the same sort of situation?
Well, yes. So earlier this year, the demand for HRT medicines went up, and unfortunately the supply was patchy again. So since the beginning of this year, we have raised this issue that there is something the matter with the supply chain and we need to address it, asking the Department of Health to bring stakeholders together to identify this, because we cannot continue being in this situation, every time. So, in the spring, in summer, in winter. So there's got to be a solution to this going forward. And that comes back to having that communication and planning in place.
All right. Very good to talk to you. Thank you so much. That's Leyla Hannbeck from the Association of Independent Multiple Pharmacies. Thank you.